The trauma doors slammed open so hard they bounced off the wall. A stretcher came flying through the ER entrance. The man on it was bleeding badly, his face pale under the harsh hospital lights. A medic shouted vitals while running beside the bed. Male 62. Vehicle crash. Possible internal bleeding. BP dropping. But none of that was what made the room freeze, because standing on the stretcher was a dog. Not just any dog. A full-grown German shepherd wearing a worn tactical harness. And it was growling. The deep kind of growl that tells everyone in the room this is not the moment to get brave. The trauma team stopped dead. Doctors, nurses, a respiratory tech. Even the police officer escorting the patient. Nobody moved closer. The dog stood over the injured man like a guard at a prison gate. Its paws planted on the mattress, ears forward, teeth just visible. The injured man didn't react. He was unconscious. Someone near the door whispered, "Is that a K9?" The officer nodded slowly. Military dog. The patient was Major General Thomas Wade, retired, and apparently, his dog had decided the emergency room was now a battlefield. Inside the trauma bay, monitors beeped impatiently. The general's oxygen levels were dropping. Blood soaked through the blanket over his torso, but the problem was simple. Nobody could touch him. One of the nurses leaned toward the officer holding the leash. "Can you control the dog?" The officer looked embarrassed. "I'm not the handler." That's when someone noticed the handler. He was sitting against the wall just outside the trauma bay, dazed, a hand on the back of his head. Another paramedic checked him quickly. "Concussion," he muttered, which meant the one person who could control the dog currently couldn't. Inside the room, the ER doctor stepped forward carefully. Dr. Nolan Pierce had been running trauma cases for 15 years. He wasn't easily intimidated, but he stopped when the dog's growl got louder. The dog shifted its stance. It didn't bark. It didn't snap. It simply made it very clear the next person who got close might regret it. Pierce looked at the charge nurse. Tanya Brooks had the same expression everyone else did. "We can't work around a military shepherd." Nobody argued with that. The room had gone strangely quiet except for the monitor alarms. The general's blood pressure kept falling. Pierce exhaled slowly. "Okay, let's think." Then someone moved. Not quickly, not dramatically, just one calm step forward. A nurse wearing Navy scrubs walked past the rest of the staff and into the trauma bay. Her name badge read Paige Bennett. She had started working at Harbor Ridge Regional Medical Center just 8 days earlier, which meant she was technically the newest nurse in the room. Tanya saw her moving and immediately spoke. "Paige, stop." Paige didn't stop, not because she was ignoring Tanya, but because she was watching the dog. Every step she took was slow and deliberate. No sudden movements, no raised voices. The dog turned its head toward her. The growl continued. One of the younger nurses whispered behind her. "Oh my God." Dr. Pierce said quietly, "Ma'am, don't get closer." Pagetly, "Ma'am, don't get closer." Paige didn't answer. She stopped about 6 feet from the stretcher. The dog's eyes locked on her. For a moment, the entire trauma bay looked like a frozen photograph. Then Paige spoke. Not loudly, just one word. "Down." The tone wasn't casual. It wasn't the voice people usually use with pets. It was clipped, controlled, almost like a command given on a training field. The dog paused. The growl faded just a little. Everyone in the room noticed. Paige took another slow step forward. "Down," she said again. Same tone, same rhythm. The dog blinked once, then slowly it stepped off the stretcher. It didn't leave. It simply sat beside the bed. Calm, quiet, like it had decided this woman was suddenly in charge. The trauma team stared. Nobody spoke for a full second. Then Dr. Pierce snapped back into motion. "Airway check, let's move." The room exploded into action. A respiratory therapist slid in to check, irritatory therapist slid in to check breathing. Tanya grabbed a blood pressure cuff. Another nurse connected IV lines. The dog stayed seated near the wall, watching everything but not interfering. Pierce leaned over the patient. Okay, let's see what we've got. The paramedic handed over the chart. Crash at highway speed. Possible abdominal trauma. Pierce nodded. Get the ultrasound. The portable fast scanner rolled beside the bed. The screen flickered to life. Everyone focused on the images. Within seconds, Pierce frowned. Fluid in the abdomen. That meant internal bleeding. It was serious, but it wasn't unusual. Trauma teams saw that every week. Pierce nodded to the nurse preparing blood units. Let's prep him for surgery. Across the bed, Paige watched the monitor. Her eyes narrowed slightly. Something felt wrong. The numbers didn't match what she expected. Oxygen saturation kept slipping. 89, 86. That was faster than it should be. Pierce noticed too. Respiratory. The tech checked the ventilator bag. Airway looks clear. Paige stepped closer to the bed. She looked at the patient's chest, then at the monitor again. The left side of the chest rose just a little slower than the right, barely noticeable. Most people wouldn't see it, but Paige had spent years staring at patients in the back of evacuation aircraft where small changes meant life or death. Her voice cut through the noise. I think he's developing a tension pneumothorax. The room went quiet again. Dr. Pierce turned toward her. He studied the patient, then the monitor, then Paige. How sure are you? Paige didn't hesitate. Very. The dog lifted its head from the floor and watched her closely. For a moment, nobody moved. Then Pierce reached for a needle kit. Let's find out. The entire trauma team leaned in as he positioned the needle above the patient's ribcage. If Paige was wrong, it would mean wasted seconds. If she was right, he pushed the needle in. A loud hiss of escaping air filled the room. Pierce looked up. Well, he said, looks like the new nurse was right. The sharp hiss of escaping air faded as Dr. Pierce pulled the needle back and looked at the monitor again. Numbers started climbing, slowly at first, then steadily. The oxygen level rose from the mid-80s into the 90s, and the patient's blood pressure followed a few seconds later. Around the trauma bay, people exhaled without realizing they had been holding their breath. Pierce glanced back at Paige. Well, he said almost amused, that was a good call. Paige didn't smile. She was still watching the patient's chest rise and fall. His breathing should stabilize now, she said. Pierce nodded once and turned back to the team. Let's keep moving. The room snapped back into motion again. Tanya hung a bag of blood. The respiratory tech adjusted the oxygen line. Another nurse wiped away blood so the surgeons upstairs wouldn't have to work through a mess. The general still hadn't regained consciousness, but at least now he had a fighting chance. Across the room, the German shepherd remained seated near the wall. Calm, quiet. Its eyes moved between the doctors and Paige like it was running its own security check. One of the younger nurses leaned toward Tanya and whispered, I thought that dog was going to eat somebody. Tanya didn't take her eyes off the IV pump. Me too. A police officer near the door finally stepped inside. He approached the dog cautiously and picked up the loose leash. The dog didn't resist. It just kept watching Paige. The officer gave a small nod. Well, he said quietly, that's the calmest he's been since the crash. Pierce was still studying the monitor. Good, he said, because if he jumps on my operating table later, I'm retiring early. A couple of people chuckled. It was the kind of dark humor that showed up in emergency rooms whenever something almost went very wrong. Pierce wiped his gloves and turned to Paige again. Where'd you learn that? Paige looked up. What? The dog command. Pierce pointed at the shepherd. That wasn't exactly basic obedience training. Paige hesitated for half a second. I've worked around military K-9 units before. The answer sounded simple. Too simple, Tanya noticed. So you train dogs? Paige shook her head. No? Then how'd you know what to say? Paige shrugged slightly. You hear the commands enough times you remember them. It wasn't technically a lie, but it also wasn't the whole story. The trauma tech wheeled the portable ultrasound machine aside as Pierce reviewed the images again. Abdominal bleeding still looks likely, he said. Tanya nodded. Surgery team already called. Good. Pierce looked at Paige once more. You mind staying in here for a minute? Paige nodded. No problem. Pierce pointed to the chest tube kit. Let's get a tube in before he heads upstairs. Another nurse handed Paige sterile gloves. The two of them worked side by side without speaking much. It was the kind of quiet teamwork that only happened when people trusted each other's skills. Pierce made the incision. Paige assisted. Within minutes, the chest tube was in place and draining properly. The monitor remained stable. Pierce stepped back. That should hold him. The stretcher wheels locked again as the surgical transport team arrived. One of the surgeons glanced at the chart quickly. Vehicle crash, Pierce nodded, and pneumothorax. The surgeon raised an eyebrow. Nice catch. Pierce pointed toward Paige. Not me. The surgeon looked at her. You new here. 8 days. He gave a short laugh. 8 days, and already saving generals. Paige wiped her gloves clean and didn't respond. Across the room, the German shepherd shifted position as the surgical team prepared to move the stretcher. The officer tightened his grip on the leash. Easy, he murmured. The dog stood up slowly. For a moment, everyone paused again, waiting to see if the earlier calm had been temporary. But the dog simply walked beside the stretcher. Silent, alert, protective. Tanya noticed the way the dog stayed closest to Paige's side of the bed. Looks like you've got a fan, she said. Paige glanced down briefly. The dog's eyes met hers. Then it looked away. The surgical team unlocked the wheels. Let's go. They rolled the stretcher toward the elevator that led to the operating rooms upstairs. The officer walked beside the dog. Pierce followed behind them for a few steps before stopping in the hallway. Once the stretcher disappeared around the corner, he leaned against the wall and rubbed his forehead. Tanya crossed her arms. That was interesting. Pierce nodded. That's one way to describe it. A younger nurse stepped closer. So what exactly happened with the dog? The officer shrugged. He's trained military working dog. Sometimes they guard their handler or partner if they think something's wrong. Tanya looked toward Paige. And somehow Paige told him everything was fine. Paige rinsed her hands at the sink. I told him to stand down. The officer gave her a curious look. Most people don't know how to do that. Paige dried her hands. Most people don't work in hospitals where soldiers show up. The officer considered that. Then he nodded slowly. Fair point. Pierce was still studying Paige with a thoughtful expression. You've worked around the military before, he said. Paige met his eyes. Yes. Where? She paused. Different places. Pierce smiled slightly. That's not an answer. Paige didn't argue. Across the room, the younger nurse whispered to Tanya again. She's not just a regular ER nurse, is she? Tanya didn't answer right away. She had noticed a few things over the past week. The way Paige moved in a trauma room. The way she never panicked. The way she scanned exits and equipment automatically like someone trained to expect chaos. And now this. Tanya glanced toward the hallway where the stretcher had disappeared. Probably not, she said quietly. The police officer checked his watch. Once the handler's cleared, he'll take the dog. Pierce nodded. Good. But the officer added one more thing. Though the dog seems pretty attached to her. Everyone looked at Paige again. She didn't seem surprised. The ER doors opened again as another patient arrived. The hospital didn't stop just because one crisis had passed. Pierce pushed himself off the wall. All right, he said. Back to work. Paige stepped toward the next trauma bed as nurses and doctors moved around her. But across the room, the German shepherd kept watching her. And Dr. Pierce was still thinking about something. Because in 15 years of emergency medicine, he had seen a lot of unusual things. But a brand new nurse walking straight into a growling military K9 and shutting it down with one command was definitely near the top of the list. and the way she had spotted that chest injury so quickly. That wasn't beginner's luck. That was experience. Real experience. The kind that usually came from somewhere far away from a civilian emergency room. Dr. Pierce kept staring at the hallway where the stretcher had disappeared, then looked back at Paige like he was still doing the math in his head. The ER noise quickly filled the space again. A paramedic rolled another patient through the doors. Phones rang. Monitors beeped. Someone argued about lab results across the station. It was a normal emergency room again. But Pierce still looked distracted. Tanya noticed. "You're doing that thing again," she said. Pierce raised an eyebrow. "What thing?" "The thinking face." "I don't have a thinking face." "You absolutely do." Pierce sighed. "I'm just replaying the last 5 minutes." Tanya leaned against the desk. Which part? Pierce gestured toward Paige, who was now helping a respiratory tech move equipment. "That part." Tanya smirked. "You mean the part where the dog didn't eat anyone?" Pierce shook his head. "No, the part where she spotted a tension pneumothorax before the ultrasound even finished." Tanya shrugged. "She's sharp." Pierce folded his arms. "Sharp is one thing." He lowered his voice. That was instinct. Across the room, Paige finished securing a portable oxygen tank onto a cart. The younger nurse from earlier walked up beside her. "Hey." Paige glanced over. "Yeah?" "That thing with the dog." Paige waited. "That was kind of amazing." Paige shrugged. "It listened?" The nurse laughed. "That dog was about 3 seconds away from turning Dr. Pierce into lunch." Paige allowed a small smile. "Well, Pierce probably would have tasted terrible." The nurse grinned. "Okay, that's fair." They both looked toward the hallway again. The general was now somewhere upstairs in surgery. Paige's expression grew quieter. The nurse noticed. "You okay?" "Yeah." "You look like you're still thinking about it." Paige glanced back toward the trauma bay where the incident had happened. "I'm thinking about the oxygen drop." The nurse blinked. "The pneumothorax." "Yeah. You caught it pretty fast." Paige nodded slightly. His chest movement was uneven. The nurse frowned. "I didn't see that." "Most people wouldn't." The nurse leaned closer. "Have you worked trauma before?" Paige wiped her hands with a paper towel. "Everyone in an ER works trauma." The nurse shook her head. "No, I mean real trauma." Paige didn't answer right away. Before she could respond, Pierce walked over. "Paige." She turned. "Yeah?" Pierce pointed toward the staff desk. "You got a minute?" "Sure." The younger nurse drifted away as Paige followed Pierce. Tanya was already standing at the desk with 2 cups of coffee. She handed one to Pierce. "Thought you might need it?" Pierce took a sip and nodded toward Paige. "So." Paige waited. Pierce leaned against the counter. "I want to go over something." "Okay. You saw the pneumothorax before I did." "Yes." How Paige answered without hesitation, his oxygen saturation dropped faster than expected for abdominal bleeding. Pierce nodded. "That's what caught your attention?" "Yeah." Pierce tapped the desk. "But you also said the chest expansion looked off. Left side lagged slightly." Pierce smiled faintly. "That's a hard thing to notice in a crowded trauma room." Paige shrugged. "I've seen it before." Pierce tilted his head. Where Paige met his eyes calmly. "Different hospitals." Pierce held her gaze for a moment. Then he nodded slowly. "Fair enough?" Tanya wasn't convinced. She leaned forward. "You ever work military medicine?" Paige looked at her. "Why do you ask?" Tanya pointed toward the trauma bay. "You handled that K9 like someone who's done it before." Paige took a sip of water. "I've been around working dogs." Pierce chuckled quietly. That's still not an answer. Before Paige could reply, the police officer returned from the hallway. "The handler's awake." Tanya looked relieved. "Good. He's asking for the dog." Pierce nodded. "Where is it?" The officer gestured toward the waiting area. The German Shepherd was lying near the wall, alert but calm. Paige glanced toward it briefly. The officer noticed. "That dog trusts you." Paige shook her head. "He just recognized the command." The officer smiled. "Most people don't." Pierce pushed away from the desk. "Let's check on the handler." They walked toward the waiting area together. The handler sat in a chair with an ice pack on the back of his head. He looked groggy but conscious. When the dog saw him, it stood immediately. The handler smiled weakly. "Hey, buddy." The dog walked over and sat beside him. Pierce crouched slightly. "You feeling all right? Head hurts. You had a concussion." The handler nodded slowly. "Where's the general in surgery?" The handler looked worried. "He gonna make it?" Pierce shrugged slightly. "He's got a good shot." The handler relaxed a little. Then he looked at Paige. "You're the one who gave Rex the command." Paige nodded once. "Yes." The handler studied her for a second. "You military," Paige hesitated. "A while back." The handler smiled. "Knew it." Pierce noticed Paige didn't elaborate. Instead, she turned toward the dog. Rex looked back at her with calm recognition. The handler scratched the dog's ear. "He doesn't listen to many people." Paige shrugged. "He did today." The handler laughed softly. "Guess he knew you knew what you were doing." Across the room, Pierce watched the interaction carefully. Tanya leaned toward him and whispered, "You're still doing the thinking face." Pierce murmured back, "Because none of this adds up." Tanya raised an eyebrow. "What do you mean?" Pierce kept his eyes on Paige. "She's been here 8 days. So most nurses need 6 months to move around a trauma room that smoothly." Tanya nodded slowly. Pierce continued, "And she spotted a chest injury that fast." And Pierce lowered his voice. "And she shut down a trained military dog with one command." Tanya followed his gaze toward Paige again. The dog sat calmly beside its handler. Paige stood nearby, quiet as usual. Pierce exhaled. "I've been running ER trauma for 15 years. Tanya crossed her arms. "And," Pierce said quietly, "I'm starting to think our new nurse hasn't told us the whole story." Paige didn't react when Dr. Pierce said it, but she knew exactly what he meant. Emergency rooms had a rhythm. After a major trauma, the chaos faded into paperwork, charting, and quiet conversations in corners. People replayed what happened while pretending they weren't. Paige had seen that pattern in hospitals before. She just hadn't expected to be the center of it. Back at the nurses' station, Tanya pulled up the patient's chart while Pierce finished documenting the procedure. The ER looked calm again, but the conversation around Paige hadn't stopped. 2 nurses near the supply cabinet were whispering. "Did you see how she walked right up to that dog?" "Yeah, I thought security was going to tase it." And then she just said one word. "Yeah," like it was nothing. They both glanced toward Paige. Paige pretended not to notice. She focused on restocking the trauma cart instead. Alcohol wipes, saline flushes, IV catheters. Routine tasks had a way of quieting a busy mind. But the quiet didn't last long. Tanya called from the desk. "Paige, can you come here a second?" Paige walked over. "What's up?" Tanya turned the computer monitor slightly. "Just confirming something for the report." "What report?" "The trauma report for General Wade." Paige nodded. "Okay," Tanya tapped the screen. "It asks who first suspected the pneumothorax." Paige didn't hesitate. "I did." Pierce added without looking up. "Correct." Tanya entered the note. Then she looked back at Paige. "Where'd you learn to spot that?" Paige answered calmly. "Working trauma cases." Pierce leaned back in his chair. "You keep saying that." Paige shrugged. "It's true." Pierce studied her. "Most nurses take years to develop that kind of pattern recognition." Paige crossed her arms. "Maybe I'm a fast learner." Tanya snorted softly. Pierce ignored the joke. "What hospitals did you work at before Harbor Ridge?" Paige thought for a moment. "Mostly travel assignments." Pierce nodded slowly. "Which ones?" Paige listed a few hospitals in different states. They were real places, but they weren't the full story. Pierce typed the names into the chart system for verification. "All right," he said. Then he looked up again. "And the dog." Paige sighed quietly. "What about it?" Pierce leaned forward. "You handled that situation like someone who's done it before." Paige answered evenly. "I told you. I've been around working dogs." Pierce raised an eyebrow. "Military working dogs." Paige met his gaze. Yes. Tanya leaned back in her chair. That's not something people casually run into. Paige didn't respond. Across the room, the ER doors opened again. Another ambulance arrived. Everyone turned automatically. But it was only a minor injury case. The tension eased. Pierce rubbed his chin. You ever work on a base hospital? Paige hesitated. For a while. Tanya's eyebrows went up. Which base? Paige took a breath. Joint Base Lewis McChord. Tanya blinked. That's 20 minutes from here. Pierce nodded slowly. Military medical rotation. Paige shrugged. Something like that. Tanya gave Pierce a look. Pierce understood it. Something about Paige's answers felt careful. Not dishonest. Just incomplete. The police officer walked back through the ER at that moment. The handler's getting discharged, he said. He's taking the dog with him. Yeah. Pierce nodded. Good. The officer paused before leaving. Oh, and the general surgical team just called. Everyone turned. Pierce stood up. What's the update? They're still operating, but they said the chest decompression probably saved him. Pierce looked toward Paige again. Well? Paige said nothing. The officer continued. Apparently, his lung had already started collapsing. Tanya exhaled slowly. Good catch. The officer nodded once before leaving. Pierce sat back down. For a moment, nobody spoke. Then Tanya said quietly, You know what's interesting? Pierce glanced at her. What? You never panicked. Paige looked confused. About what? The dog. Paige shrugged. Panicking wouldn't help. Tanya tilted her head. Most people panic when a 90-pound military shepherd is growling 2 feet away. Paige thought about that. Fair point. Pierce folded his arms. You walked toward it. Yes. Why? Paige answered simply. Because the patient needed treatment. Pierce watched her for a second. That's a very ER answer. Paige gave a small smile. It's the honest one. The younger nurse from earlier returned with lab results. Hey, Tanya, labs are back. Tanya glanced at the sheet. Thanks. The nurse hesitated, then looked at Paige. So, random question. Paige waited. Were you a medic? Pierce immediately looked interested. Paige didn't react. No. The nurse frowned. Really? Yes. Pierce asked casually. Then what were you? Paige took a sip of water. A nurse. Pierce leaned back. In the military? Paige nodded once. Yes. The younger nurse's eyes widened. That explains a lot. Pierce studied her carefully. How long? Long enough. Tanya laughed softly. You're not big on details, are you? Paige shook her head. Not really. Pierce wasn't smiling. Because something about that answer confirmed his suspicion. This wasn't a nurse who had casually spent time around military medicine. This was someone who had lived inside it. The ER phone rang loudly on the desk. Tanya answered it. Emergency department. She listened for a moment. Okay, got it. She hung up. Surgery update. Pierce looked up, and Tanya nodded. They stopped the internal bleeding. Pierce exhaled. That's good news, Tanya added, and the surgeon said, if the lung pressure hadn't been relieved when it was, she glanced toward Paige. He probably wouldn't have made it to the operating room. The room went quiet again. Paige looked down at the floor briefly. Pierce finally spoke. You know, he said slowly, I think Harbor Ridge just got a lot luckier than we realized when you walked through that door last week. Paige didn't respond. She just grabbed a fresh pair of gloves and headed toward the next patient bed. Because in an emergency room, there was always another patient waiting. And questions about the past rarely stayed buried forever. The ER had settled back into its usual rhythm when the automatic doors opened again and the police officer returned with the dog's handler walking beside him. The handler looked steadier now, still a little pale but upright. Rex walked calmly at his side. The moment the dog stepped inside the ER again, a few nurses instinctively shifted a little farther away. Not out of fear, just caution. The handler noticed and gave a small apologetic smile. "He's good," he said. "Promise." Rex didn't seem interested in anyone else in the room anyway. His attention went straight to Paige. He stopped beside her, sat, calm and alert. Paige looked down at the dog. "Hey." Rex's ears twitched slightly. The handler chuckled. "Yeah, he likes you." Paige shrugged. "Dogs like calm people." The handler nodded thoughtfully. "True." Dr. Pierce walked over, wiping his hands with a paper towel. "How's your head?" The handler touched the back of his skull. "Still hurts, but I've had worse." Pierce smirked. "I'll bet." The handler extended a hand. "Name's Sergeant Kyle Mercer." Pierce shook it. "Nolan Pierce." Mercer nodded toward Paige. "You saved my dog from getting himself in a lot of trouble." Paige shook her head. "He was protecting his partner." Mercer looked impressed. "Most civilians don't understand that." Pierce glanced at Paige. "She's not exactly a civilian, apparently." Mercer studied her face. Military Paige gave a small nod. "Yes." Mercer's eyes narrowed slightly. "What branch?" "Air Force." Mercer grinned. "Figures." Pierce raised an eyebrow. "What does that mean?" Mercer shrugged. "Air Force med teams work with K-9 units sometimes during deployments." Paige said nothing. Across the room, Tanya was pretending to check a medication cart while listening carefully. Mercer continued. "You ever deployed?" Paige answered simply. "Yes." Pierce folded his arms. Where Paige hesitated for half a second. "Afghanistan." The word hung in the air for a moment. Mercer nodded slowly. "Thought so." Pierce looked mildly surprised. "Well, that explains a few things." Mercer scratched Rex behind the ear. "Which unit were you with?" Paige replied calmly. "Critical care evacuation." Mercer's eyebrows lifted. "Seriously?" Paige nodded. Mercer looked impressed. "That's serious work." Pierce glanced between them. "What's evacuation?" Mercer explained. "They stabilize wounded soldiers and move them to surgical hospitals or back to the States." Pierce nodded. "So basically flying trauma units." "Exactly." Pierce looked at Paige again. "That would explain the pneumothorax call." Paige shrugged. "You see enough chest trauma, you recognize the signs." Mercer leaned back slightly against the wall. "You ever work with forward surgical teams?" Paige nodded once. "Sometimes." Mercer looked thoughtful. "What year were you there?" Paige answered quietly. "About 6 years ago." Mercer paused. Then his expression shifted slightly. "What area? Helmand Province?" Mercer straightened. "No kidding." Paige met his eyes. "Yes." Mercer rubbed his chin. "Small world." Pierce watched the exchange closely. What Mercer shook his head slowly. "I ran convoy security in Helmand around that time." Paige didn't react. Mercer continued. "You guys flew some pretty bad cases out of there." Paige nodded. "Yes." Mercer glanced toward Rex. "Some nights were rough." Paige's voice stayed steady. "Yes." Mercer studied her for another moment. "Did you ever work the mass casualty night outside Sangin?" The question hit the air like a dropped tool. Paige froze just slightly. It was subtle, but Pierce saw it. So did Tanya. Mercer continued carefully. "That was a bad one." Paige answered quietly. "Yes." Pierce spoke. "What happened?" Mercer shook his head slowly. "Insurgent attack. Convoy got hit." He looked back at Paige. "A lot of wounded." Paige's eyes lowered for a moment. Then she nodded. "Yes." Mercer watched her carefully. "I think your team handled that evacuation." Paige didn't deny it. Pierce leaned against the desk. "How many casualties?" Mercer exhaled slowly. "Too many." The ER grew quieter around them. Even the younger nurses had stopped pretending not to listen. Mercer continued. "One of our guys didn't make it." Paige's hands tightened slightly. Pierce noticed. Mercer glanced down at Rex. "Private Luke Briggs." The name sat heavy in the room. Paige didn't move. Pierce looked between them. "What happened to him?" Mercer answered slowly. Evac helicopter was overloaded. They had to triage. Pierce nodded. That word meant something specific in trauma medicine. Choosing who got treatment first. Mercer continued. Briggs was stable for a while. Then he crashed before they could move him. Page's voice stayed calm. I remember. Mercer looked surprised. You do? Yes. Pierce studied her expression. What happened? Page answered carefully. We had too many critical patients and not enough flight capacity. Mercer nodded. That's what we heard, Pierce said quietly. That's a terrible position to be in. Page didn't argue. Mercer crossed his arms. Briggs was a good soldier. Page looked up. Yes. Mercer noticed something in her voice. You knew him, Page answered simply. He was one of my patients. The ER fell silent again. Pierce spoke carefully. And he didn't make it. Page shook her head once. No. Mercer looked thoughtful. War's ugly like that. Page nodded. Yes. Mercer reached for Rex leash. Well, I guess I'll get this guy back to the base. Pierce shook his hand again. Take care of that head. Mercer smiled. Will do. He paused before leaving, then looked at Page. You did good today. Page didn't respond. Mercer added quietly, and for what it's worth, nobody blamed the evac team for Briggs. Page nodded slightly. Mercer walked out of the ER with Rex beside him. The doors closed behind them. For a moment, nobody said anything. Then Pierce looked at Page again, and now he understood something important. Because that calm, controlled nurse who walked toward a growling military dog without hesitation was someone who had already spent years making impossible decisions in places most people never saw. Page stood at the sink longer than necessary, letting the water run over her hands, even though they were already clean. Across the ER, the noise had returned to normal levels. Phones rang. A monitor alarm chirped somewhere behind the nurse's station. A paramedic wheeled an empty stretcher back toward the ambulance bay. But Page's attention wasn't on any of it. Her mind had gone somewhere else. Dr. Pierce noticed. He walked over quietly and leaned against the counter beside her. You all right? Page shut off the water and grabbed a paper towel. Yeah. Pierce studied her expression. That didn't look like a casual memory. Page dried her hands slowly. No. Pierce nodded. Triage decisions stick with you. Page didn't respond right away. Instead, she walked over to the medication cabinet and began organizing the syringes that were already perfectly organized. Pierce watched her for a moment. I've done ER trauma for 15 years, he said. Page kept working. And I still remember my worst calls. Page placed another syringe into the tray. Which one? Pierce shrugged. Motorcycle crash. Kid was 19. He paused. We had 2 trauma patients arrive at the same time. Only 1 surgical team available. Page understood immediately. Pierce continued. We chose the other patient first. And the kid died. Pierce nodded. Yes. Page set the tray down. Triage isn't choosing who dies. Pierce looked at her. It feels like it. Page shook her head slowly. It's choosing who has the best chance to live. Pierce gave a quiet laugh. You sound like someone who said that before. Page leaned against the counter. I have. Across the room, Tanya glanced toward them. She couldn't hear the conversation, but she could see the tone of it. Serious. Focused. Not casual. Pierce crossed his arms. Tell me about Sangan. Page's eyes shifted slightly. Why? Because Mercer mentioned it, and you looked like someone had opened an old file in your brain. Page took a breath. You ever work a mass casualty event? Pierce nodded. A few. Page looked down briefly. Imagine that, but with helicopters. Pierce waited. Page continued. Convoy got hit outside Sangan. Improvised explosive device followed by small arms fire. Pierce pictured it. That's bad. Yes. How many wounded? Page answered without emotion. 9. Pierce whistled softly. That's a lot. We had 2 evacuation helicopters, and each bird could safely carry 4 critical patients. Pierce did the math immediately. 9 patients. Paige nodded. Correct. Pierce leaned forward slightly, so someone had to stay behind. Yes. Pierce asked the obvious question. Briggs. Paige nodded once. Yes. Pierce rubbed the back of his neck. What were his injuries? Shrapnel to the leg and abdomen. Pierce frowned. Potential internal bleeding. Yes. Why categorize him? Delayed Paige answered calmly. 2 other soldiers had severe chest trauma and airway compromise. Pierce nodded slowly. Immediate category. Yes. Paige continued. We stabilized Briggs as best we could and loaded the helicopters. Pierce asked quietly, and he crashed before the next flight arrived. Yes. Pierce exhaled. War medicine is brutal. Paige nodded. Yes. Across the room, Tanya pretended to sort paperwork while listening carefully. The younger nurse whispered beside her. What are they talking about? Tanya answered quietly. Combat triage. The nurse blinked. Oh, Tanya shook her head. You don't want to hear the details. Back near the counter, Pierce looked at Paige again. Did Briggs say anything before the helicopters left? Paige hesitated. Then she nodded. Yes. Pierce waited. Paige spoke quietly. He asked if he was going home. Pierce's expression softened. What did you tell him, the truth? Pierce tilted his head. Which was, that we were working on it. Pierce gave a sad smile. That's about all you can say? Paige nodded. Yes. The ER doors opened again and a patient walked in holding his wrist. A minor injury. Tanya pointed the man toward the triage desk. Life continued around them. Pierce spoke again. You blame yourself. Paige didn't deny it. Pierce sighed. That's common. Paige looked at him. It shouldn't be. Pierce shrugged. But it is. Paige folded her arms. Triage decisions are math. Pierce raised an eyebrow. Math? Yes. Pierce laughed softly. That's a cold way to describe it. Paige shook her head. No, it's honest. Pierce studied her face carefully. You still remember his name? Yes. 6 years later? Yes. Pierce nodded slowly. That's the part nobody tells civilians about military medicine. Paige didn't respond. Pierce continued. You don't just remember the patients you saved. You remember the ones you couldn't. Paige looked toward the ER entrance. Yes. Pierce pushed himself away from the counter. Well, he said lightly, trying to shift the mood. Today you saved a general. Paige shrugged. That's the job. Pierce smirked. Most nurses don't save generals before lunch. Paige almost smiled. Across the room, Tanya called out. Pierce ambulance incoming. Pierce turned immediately. What have we got? Tanya checked the radio. Construction accident. Possible spinal. Pierce nodded. All right. He grabbed a pair of gloves and started toward the trauma bay. Then he paused and looked back at Paige. You coming? Paige pulled on gloves of her own. Of course. Pierce grinned slightly. Good. Because if there was one thing he was absolutely certain about now, it was that the quiet new nurse working her 8th day in this ER had already handled situations far worse than anything Harbor Ridge was likely to throw at her today. The trauma bay filled again as the next ambulance crew rolled their patient through the doors, and Paige was already moving before the stretcher stopped. Construction fall, the paramedic reported. Possible spinal injury. Conscious. Dr. Pierce stepped beside the bed. Let's keep him still. Paige stabilized the patient's head while the team transferred him carefully to the hospital gurney. The process was routine. Check airway. Check breathing. Check circulation. The patient winced but remained alert. Name's Gary, he said through clenched teeth. Pierce nodded. Gary, we're going to take care of you. Paige secured the cervical collar while the rest of the team ran through the assessment. Compared to the earlier chaos with the general, this case felt simple, still serious, but manageable. Within minutes, the patient was stable and headed toward imaging. As the stretcher disappeared down the hall, Pierce peeled off his gloves. Well, he said, that one didn't involve a tactical dog. Tanya laughed softly. Give it time. Paige returned equipment to the trauma cart. The ER felt steady again, but not for long. A phone rang at the nurse's station. Tanya picked it up. Emergency department. She listened for several seconds. Then she looked toward Pierce. Surgery. Pierce walked over. What's the update? Tanya covered the receiver. They want to talk to you. Pierce took the phone. This is Pierce. He listened carefully. Paige could hear only half the conversation. Yes, I see, that's good. Pierce nodded slowly as he listened. Understood. He hung up. Tanya raised an eyebrow. Well, Pierce leaned against the desk. General Wade made it through surgery. A few nurses nearby relaxed immediately. That's good news, Tanya said. Pierce nodded. They repaired the abdominal bleeding. Paige continued organizing supplies without looking up. Pierce added, and the surgeon said the chest pressure from that pneumothorax was worse than they expected. Tanya looked toward Paige. So decompressing it when we did. Pierce finished the thought. Probably kept him alive long enough to reach the OR. Paige didn't respond. Pierce studied her expression. You realize that means you saved his life. Paige closed the supply drawer. It means the timing worked out. Pierce smirked. You really hate taking credit. Paige shrugged. It's a team job. Before Pierce could answer, the ER doors opened again. But this time, it wasn't an ambulance. A hospital administrator stepped inside. He wore a pressed shirt and looked slightly uncomfortable being anywhere near the trauma bay. Tanya sighed quietly. Uh-oh. Pierce noticed. What administrators never visit the ER unless something interesting happened. The administrator approached the desk. Dr. Pierce nodded. That's me. I'm David Harlan from Hospital Operations. Pierce shook his hand. What can we do for you? Harlan glanced around the room. I just came from the surgical floor. Pierce waited. Harlan continued. General Wade regained consciousness briefly. Paige stopped moving. Not visibly, but Pierce noticed. Harlan added, and he asked a question. Pierce crossed his arms. What question? Harlan looked around. He asked who saved him. The ER grew quieter. Pierce looked toward Paige again. Well, he said lightly, that's easy. Harlan nodded. The surgical team told him about the pneumothorax. Tanya leaned forward, and Harlan looked at Paige. He asked to meet the nurse who caught it. Paige spoke calmly. He just woke up from surgery. Harlan nodded. Yes. Paige turned back to the supply cart. He should focus on recovery. Pierce chuckled. Most generals don't like being told what they should focus on. Harlan smiled slightly. That's true. He looked at Paige again. But apparently, he's very interested in thanking you. Paige closed another drawer. I was doing my job. Pierce leaned against the desk. You're going to have to get used to the idea that people might notice. Paige gave him a sideways glance. I'd rather they didn't. Harlan checked his notes. Well, regardless, the surgical team said he'll be monitored in ICU overnight. Pierce nodded. That's standard. Harlan looked relieved. Good. He paused before leaving. Oh, one more thing. Pierce waited. The general also asked about the dog. Tanya smiled. Of course he did. Harlan continued. The handler told him the dog behaved calmly once a nurse spoke to it. Pierce glanced at Paige again, and Harlan shrugged. He seemed curious how that happened. Paige finally looked up. Military working dogs are trained to recognize command tone. Harlan nodded slowly. I'll pass that along. He left the ER a moment later. The doors swung shut behind him. For a moment, nobody said anything. Then Tanya leaned back in her chair. Well, she said, today just keeps getting weirder. Pierce rubbed his chin thoughtfully. I've had stranger shifts. Tanya smirked. Name one. Pierce thought about it. Actually, maybe not. Paige moved toward the next patient chart. But Pierce stopped her gently. Hey. She looked at him. You might want to be ready. For what? Pierce shrugged. Retired generals tend to ask a lot of questions. Paige folded her arms. I answered plenty today. Pierce smiled slightly. I'm sure you did. Across the ER, The younger nurse whispered to Tanya again. Do you think the general will remember all this? Tanya shrugged. If someone saves your life, you usually remember. Pierce looked back toward the hallway leading upstairs, and now he was curious about something else, because the general wasn't the only one who had started asking questions about Paige Bennett today, and he had a feeling the answers might explain a lot more than just how she handled a military dog. Paige had just finished updating the last patient chart when her phone vibrated quietly in the pocket of her scrubs. She ignored it at first. Phones weren't supposed to matter in the middle of a shift. But a moment later it vibrated again. She stepped away from the desk and glanced at the screen. Unknown number. She almost put it back in her pocket. Then the message preview appeared. My name is Evan Briggs. I think you knew my brother. Paige felt the air leave her lungs. For a second, she didn't move. The name sat there on the screen like something pulled straight out of a memory she had spent years trying not to open. Across the EER, Pierce noticed the change in her posture. He walked over slowly. You look like someone just texted you bad news. Paige didn't answer immediately. Instead, she read the rest of the message. My brother, Luke Briggs. Afghanistan. Sang an attack. Pierce watched her carefully. That the same Briggs Mercer mentioned earlier, Paige nodded once. Yes. Pierce leaned slightly closer. Family member Paige turned the phone toward him. Pierce read the message. He raised his eyebrows. Well, he said quietly, that's unexpected. Paige took a breath. Yeah. Pierce gestured toward the break room. You should probably take that somewhere quieter. Paige nodded. She walked down the short hallway into the staff break room and sat at the small table near the vending machines. The room smelled faintly like stale coffee. Her phone vibrated again. Another message. I've been trying to find you for years. Paige stared at the words. Then she typed back. This is Paige. She waited. The reply came almost instantly. Thank you for answering. Paige rubbed her forehead. Pierce leaned against the doorway. Everything okay? Paige glanced up. His brother. Pierce nodded slowly. That's a complicated conversation. Paige looked back at the screen. Yes, another message appeared. My brother wrote about you. Paige froze. Pierce saw it immediately. What did he say? Paige read the next message silently. Her expression changed. Pierce waited. Finally, she spoke. He said Luke wrote letters home during deployment. Pierce nodded. That's common. Paige swallowed. One of them mentioned a nurse who stayed with him when things got bad. Pierce frowned slightly. That you? Paige nodded. Yes. Pierce leaned forward. What exactly did the message say? Paige handed him the phone. Pierce read the text carefully. Luke wrote that you were the one who held pressure on his wounds while the helicopters loaded the other patients. Pierce looked up slowly. Paige continued quietly. He said Luke told our family you didn't leave him. Pierce sat down across from her. That's important. Paige stared at the table. I always thought he died alone. Pierce shook his head. Sounds like he didn't. Paige took a breath. Her phone vibrated again. Another message. I don't know if anyone ever told you this, but my brother wasn't angry about what happened. Pierce read the screen over her shoulder. He nodded. That makes sense. Paige looked up. How Pierce shrugged. Soldiers understand triage better than civilians do. Paige wasn't convinced. He died waiting for evacuation. Pierce answered calmly. And he knew the helicopters were full. Paige didn't speak. Another message arrived. My parents wanted to thank you. They always said whoever stayed with Luke at the end deserved to know he wasn't alone. Paige leaned back in the chair. For a long moment, she didn't move. Pierce spoke carefully. That's probably the message you needed. Paige looked at him. I didn't do anything special. Pierce shook his head. You stayed. Paige said quietly, I couldn't leave him. Pierce nodded. That matters. Her phone vibrated again. If you ever want to talk, I'd like to hear about what happened that night. Paige stared at the message. Pierce waited. Finally, she typed a short reply. I remember him. The answer came seconds later. That means a lot. Paige locked the phone screen. For the first time since Mercer mentioned the convoy attack, the tension in her shoulders eased slightly. Pierce noticed. You feel better, Paige thought about it. A little. Pierce smiled faintly. That's how these things work. Paige looked toward the break room window. I spent 6 years thinking I failed him. Pierce leaned back in his chair. Combat medicine doesn't give you perfect endings. Paige nodded. No. Pierce stood and stretched. Well, at least today one of your patients lived. Paige allowed a small smile. Yes. They walked back into the ER together. The normal chaos had returned. A nurse argued with a pharmacy tech about medication dosing. Someone wheeled a patient toward imaging. Tanya glanced up as Paige approached. You all right? Paige nodded. Yeah. Tanya studied her face. You look different. Paige shrugged. Just got some news. Pierce leaned against the desk. Turns out Briggs' family remembers things differently than Paige does. Tanya looked confused. What do you mean? Pierce gestured toward Paige. They remember the nurse who stayed with him. Tanya's expression softened. Oh. Paige returned to the patient charts. For the first time all day, the memory of that night in Afghanistan didn't feel like an unfinished story. Across the ER, the doors opened again as another ambulance crew entered. The shift continued like every other shift, but somewhere upstairs in the ICU, a retired general was awake because Paige had spotted a life-threatening injury in time. And somewhere else entirely, a soldier's family finally knew the name of the nurse who had stayed beside their son when the war took everything else away. Paige stepped back into the ER as if nothing unusual had happened. The monitors were still beeping. 2 nurses were debating which CT scanner was available. Someone was arguing with a lab technician over delayed blood results. In other words, a normal shift. She slid into her chair at the nurse's station and opened the next patient chart. Pierce watched her for a second. Most people would take a break after a day like this. Paige didn't look up. It's only 3 in the afternoon. Pierce smiled. Fair point. Across the desk, Tanya leaned back in her chair. You know what I'm thinking about? Pierce sighed. That's always dangerous. Tanya ignored him. That dog. Pierce chuckled. Hard to forget. Tanya nodded toward Paige. I keep replaying it in my head. Pierce crossed his arms. The command, the whole thing. Tanya gestured with her pen. Most ER nurses would freeze if a military shepherd started guarding a patient. Pierce nodded. True. But she didn't. Pierce looked at Paige again. Nope. Tanya tapped the desk thoughtfully, which got me thinking about something. Pierce sighed again. I'm not gonna like this, am I? Tanya smiled. Probably not. She turned her computer screen toward him. What percentage of our trauma patients are veterans? Pierce glanced at the data. Lewis McCord is 20 minutes away. Tanya nodded. So Pierce scanned the numbers. About 30%. Tanya nodded slowly. Exactly. Pierce leaned back. Okay. Tanya pointed at the chart. And how many of our staff have military medical training? Pierce thought for a moment. None. Tanya pointed at Paige. Well, now we have one. Pierce followed her gaze. Paige was still reading patient notes, apparently uninterested in the conversation. Pierce rubbed his chin. That's actually a good point. Tanya nodded. Veterans show up here all the time. Pierce agreed. Yeah, Tanya continued. Combat injuries, PTSD triggers, service animals. Pierce looked thoughtful. And we treat them like every other trauma case. Tanya raised an eyebrow. Because we don't know anything different. Pierce glanced at Tanya. Know anything different? Pierce glanced toward Paige again. She does. Tanya nodded. Exactly. Pierce folded his arms. You're thinking about creating some kind of protocol. Tanya grinned. You know me too well. Pierce smirked. I've worked with you for 8 years. Tanya leaned closer. Imagine having someone who understands both sides. Pierce nodded slowly. Military medicine and civilian trauma care. Exactly. Pierce glanced toward Paige again. She might hate the idea. Tanya laughed. Probably. Across the room, Paige finished entering chart notes and stood up. What idea? Pierce smiled slightly. Oh, nothing. Paige narrowed her eyes. That usually means something. Tanya leaned back in her chair. We were just talking about how useful your experience might be. Paige folded her arms. For what Pierce gestured toward the ER entrance. Veterans. Paige raised an eyebrow. What about them? Pierce shrugged. We see a lot of them, yes. And we probably don't handle some situations as well as we could. Paige considered that. Such as Tanya spoke up. PTSD triggers. Pierce nodded. Service animals in the ER. Tanya added combat injury patterns. Pierce looked at Paige. You already understand those things. Paige shook her head slightly. So do a lot of military medics. Pierce smiled. None of them work here. Paige looked around the ER. That's not my responsibility. Pierce nodded. True. Tanya leaned forward. But it could be? Paige sighed quietly. You're talking about training. Pierce nodded. Something like that. Paige thought for a moment. I just started here. Pierce shrugged. And you already saved a general. Paige rolled her eyes. Again with that. Tanya grinned. It's a pretty good first week. Across the room, the ER doors opened again, but this time, no ambulance crew entered. Instead, a familiar shape appeared in the doorway. A German shepherd. Rex stepped into the ER calmly, his leash held loosely by Sergeant Mercer. Several nurses immediately noticed. Oh, great, someone muttered quietly. But Rex wasn't interested in anyone else. He walked straight toward Paige, stopped beside her, sat. The entire nurses' station watched. Paige looked down. Hey. Rex wagged his tail once. Mercer smiled. General insisted on sending him down. Pierce raised an eyebrow. Why? Mercer shrugged. Apparently the dog wanted to check on the nurse who told him what to do earlier. Tanya laughed. Well, that's a new one. Paige scratched Rex gently behind the ear. You're supposed to be resting. Mercer chuckled. He's stubborn. Pierce studied the scene. Dog sitting calmly beside Paige. ER staff watching curiously. Veterans showing up regularly from the nearby base. Then he looked at Tanya again. You might be onto something. Tanya grinned. I know. Paige glanced between them. What are you two planning? Pierce smiled. Nothing yet, Tanya added casually. But Harbor Ridge might finally have someone who understands how soldiers and hospitals collide. Paige shook her head. You're exaggerating. Pierce nodded toward the dog, sitting calmly at her side. Maybe. Then he glanced around the ER. But today made something pretty clear. Paige raised an eyebrow. What's that? Pierce said simply. Some hospitals get lucky once in a while. Rex rested his chin lightly on Paige's knee as the ER noise carried on around them. Phones rang. A patient argued with the triage nurse about wait times. Someone rolled a cart of supplies down the hallway. But Rex didn't move. Sergeant Mercer leaned against the counter, watching the dog with mild amusement. Well, he said, looks like he's adopted you. Paige scratched behind the dog's ear. He just recognizes the voice. Mercer shook his head. No, that's not it. Paige glanced up. What do you mean? Mercer gestured toward Rex. That dog trusts people who know how to handle chaos. Paige didn't reply. Across the nurses' station, Pierce folded his arms and looked at the scene again. You realize this is probably the calmest military working dog ever to sit inside our ER. Tanya nodded. And it happened right after Paige told him what to do. Pierce smirked, almost like she knew exactly how he'd react. Paige sighed quietly. I didn't do anything special. Mercer chuckled. Yeah, that's definitely not true. Rex shifted slightly and stayed where he was. The younger nurse, who had been whispering all afternoon, leaned toward Tanya again. So, this is normal. Tanya smiled. In this hospital, apparently. Paige stood up and stretched her back. Rex followed immediately, staying close to her side. Mercer laughed. See? Paige shook her head. He's just waiting for you. Mercer checked his watch. Actually, I came down for another reason. Pierce looked up. Oh, Mercer nodded. The general asked me to pass along a message. Paige stopped walking. What message? Mercer smiled. He said if the nurse who saved him ever needed a job recommendation, he'd personally sign it. Pierce laughed out loud. Well, that's not something you hear every day. Paige looked slightly uncomfortable. That wasn't necessary. Mercer shrugged. Generals tend to disagree. Across the ER, the administrator David Harlan stepped back into the department carrying a folder. Pierce raised an eyebrow. Back already, Harlan nodded. I just left the ICU. Tanya leaned forward. How's the general? Stable, Harlan said. Still asking questions? Pierce chuckled. That tracks. Harlan looked toward Paige. He specifically asked about the nurse who recognized the lung collapse. Paige crossed her arms. He should focus on healing. Harlan smiled politely. That's exactly what the ICU doctor told him. Pierce leaned against the desk again. So what brings you back down here? Harlan opened the folder. Well, after speaking with the surgical team, hospital administration started reviewing the incident. Tanya raised an eyebrow. That sounds official. Harlan nodded. It is. Paige frowned slightly. Did something go wrong? Harlan shook his head quickly. Quite the opposite. He looked around the ER. The events today highlighted something we hadn't considered before. Pierce folded his arms. What's that? Harlan glanced at Paige again. We treat a large number of military veterans here. Pierce nodded. That's true. Harlan continued. But most of our staff have no direct experience with military medical environments. Tanya smirked. Until last week. Harlan smiled faintly. Exactly. He looked down at the folder. The surgical team believes the early recognition of the pneumothorax prevented a fatal collapse. Paige shrugged slightly. It was visible on the monitor. Pierce shook his head. Barely. Harlan continued. And the security report mentioned the interaction with the military working dog. Mercer chuckled quietly. That part definitely made the report. Harlan looked thoughtful. So hospital leadership asked an obvious question. Pierce tilted his head. Which is, Harlan answered simply. What if we had someone on staff who could help bridge the gap between civilian trauma care and military patients? Tanya smiled slowly. Sounds familiar. Harlan nodded. I spoke with the chief medical officer about it. Pierce glanced toward Paige, and Harlan closed the folder. We're considering creating a small training initiative. Paige looked skeptical. For what exactly? Harlan explained. Guidelines for handling military service animals in the ER. Mercer nodded approvingly. That would help. Harlan continued. Recognition of combat injury patterns. Pierce smiled. That definitely helps. Harlan added, and support for veterans experiencing trauma responses in emergency settings. The younger nurse nearby whispered to Tanya. That actually sounds useful. Tanya nodded. Very. Paige crossed her arms. And you think I should run it? Harlan didn't hesitate. Yes. Paige shook her head. I've been here 8 days. Pierce smirked. 8 very interesting days. Paige looked at him. You're enjoying this too much. Pierce shrugged. I like solutions. Harlan spoke calmly. We're not asking you to take on administrative work. Paige waited. Just share what you know. Paige thought about that. Across the room, Rex sat patiently beside her again. Mercer scratched the dog's neck. You know, he said, soldiers trust hospitals more when someone inside understands them. Paige glanced down at Rex. The dog looked back calmly. Pierce spoke quietly. Today you handled a situation nobody else here would have known how to approach. Paige didn't argue. Tanya leaned forward. And you saved a man who would have died if that pressure in his chest kept building. Paige sighed. You're all making this bigger than it was. Pierce shook his head. No. He gestured toward the busy ER around them. This place runs on experience. Paige looked around the room. Doctors moving quickly between patients. Nurses adjusting monitors. Paramedics bringing in new cases. Pierce continued. And sometimes the right experience shows up exactly when it's needed. Rex stood up and walked beside Paige again as another ambulance siren echoed faintly outside the hospital entrance. The ER doors slid open. A new stretcher rolled in. Pierce pulled on a fresh pair of gloves. "All right," he said. "Let's see what the next one looks like." Paige stepped forward beside him, already focused on the patient as the trauma team gathered around the bed. And across the room, Rex settled calmly near the wall, watching the people in blue scrubs move with the quiet precision of a place where lives changed every single day. As the ER doors kept opening and closing that evening, Harbor Ridge Regional Medical Center slowly returned to the rhythm every hospital knows so well. New patients arrived. Doctors moved from bed to bed. Nurses checked monitors, adjusted IV lines, and kept everything running the way only experienced hospital teams can. But some shifts leave something behind, not just in the medical charts, in the people. Earlier that day, a trauma team had nearly lost a patient because a single injury was hidden in the chaos of a serious crash. A trained military dog had refused to let anyone near his partner. And in the middle of that tension, one calm voice changed everything. Moments like that are why hospital stories matter, because behind every emergency room door are doctors and nurses making decisions that most people never see, decisions that happen in seconds. Decisions built from years of experience training, and sometimes the kind of lessons that only come from places far outside a civilian hospital. For Paige Bennett, the ER at Harbor Ridge wasn't just another workplace. It was another battlefield of a different kind. Not with explosions or convoys, but with the same mission she had carried since her military days. Keep someone alive long enough to give them a chance. And sometimes the skills learned in war end up saving a life in the most ordinary place imaginable. That's something many veterans understand well. The past doesn't disappear when you come home. But every once in a while it becomes the exact reason someone else gets to go home too. Stories like this remind us how much happens inside hospitals that the outside world never sees. Every day, doctors and nurses walk into rooms where lives can change in minutes. They rely on training, teamwork instinct, and sometimes a little courage to make the right call when it matters most. And occasionally a loyal military dog and a nurse who knows exactly what to say remind everyone in the room how powerful experience can be. If you enjoy real hospital stories like this, stories about doctors, nurses, and the moments that happen inside emergency rooms, make sure you subscribe to the channel. We share powerful doctors and nurses' stories, real hospital moments, and incredible military medic experiences that most people never hear about. And sometimes the next story might begin the same way this one did, with a hospital door flying open and a team of doctors and nurses racing to save a life.